Antacid M is used to treat symptoms of too much stomach acid, such as stomach upset, heartburn, and acid indigestion. It can also relieve symptoms of extra gas, like belching, bloating, and feelings of pressure in the stomach. Simethicone helps break up gas bubbles in the gut, while aluminum and magnesium antacids work quickly to lower acid in the stomach. This medication works only on existing acid in the stomach and does not prevent acid production. It may be used alone or with other medications that lower acid production. If you are self-treating with this medication, be sure to carefully read the package instructions before using it. Liquid antacids usually work faster than tablets or capsules. If you have any questions about your product or its use, ask your pharmacist. When taking Antacid M, it is recommended to take it by mouth after meals and at bedtime as needed. It's important to follow the directions on the product package or as directed by your doctor. If you have any questions, it's best to consult with your doctor or pharmacist. If you are using the chewable tablets, make sure to chew thoroughly before swallowing and then drink a full glass of water. If using the liquid form, be sure to shake the bottle well before pouring each dose and measure the dose carefully using a medication spoon/cup. It's important not to use a household spoon as it may not provide the correct dose. Refrigerating the suspension may improve the flavor, but do not freeze it. The liquid form works best if taken without other fluids, but you can mix your dose with a little water if needed. It's important to note that this product may interact with other medications, such as digoxin, iron, pazopanib, tetracycline antibiotics, and quinolone antibiotics like ciprofloxacin, which could prevent them from being fully absorbed by your body. It's advisable to talk with your doctor or pharmacist about how to schedule your medications to prevent this issue. If your acid problems persist or worsen after using Antacid M for 1 week, or if you believe you have a serious medical problem, it's important to seek medical help immediately. If you are using this medication regularly on a daily basis for more than 2 weeks, it's recommended to consult with your doctor to determine if a different treatment is needed. Some common side effects of Antacid M include nausea, constipation, diarrhea, or headaches. If these effects persist or worsen, it's important to consult your doctor or pharmacist. The magnesium in Antacid M can lead to diarrhea. However, using an antacid that contains only aluminum along with this product can help control diarrhea. On the other hand, the aluminum in Antacid M can cause constipation. To minimize constipation, it's recommended to drink plenty of fluids and exercise. It's worth noting that diarrhea is more common with this product than constipation. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. Antacids containing aluminum can bind to phosphate in the gut, potentially causing low phosphate levels, especially if used in large doses and for a long time. It's important to inform your doctor if you experience symptoms of low phosphate, such as loss of appetite, unusual tiredness, or muscle weakness. Additionally, it's crucial to seek medical attention if you experience serious side effects such as dizziness, fainting, slow/shallow breathing, slow/irregular heartbeat, mental/mood changes, deep sleep, or pain with urination. Although rare, a serious allergic reaction to this drug is possible, and it's important to seek immediate medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. Before taking Antacid M, it's important to talk to your doctor or pharmacist if you are allergic to aluminum hydroxide, magnesium, or simethicone, or if you have any other allergies. This product may also contain inactive ingredients that could cause allergic reactions, so it's best to consult your pharmacist for more details. If you have health problems such as frequent alcohol use, dehydration/fluid restriction, or kidney problems, including kidney stones, it's important to consult your doctor or pharmacist before using this product. Antacid M may contain aspartame, so if you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist about using this drug safely. Additionally, if you have diabetes, it's important to consult your doctor or pharmacist about using this drug safely due to its sugar content. If you are pregnant, it's important to use this medication only when clearly needed and discuss the risks and benefits with your doctor. For those who are breastfeeding, it's important to consult your doctor before using this medication. When taking Antacid M, it's important to follow the recommended dosage and take it at the optimal timing, as advised by your doctor or pharmacist. It's important to be aware of any potential drug interactions with Antacid M. This can affect how your other medications work and may increase the risk of serious side effects. It's essential to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Antacid M are phosphate supplements, such as potassium phosphate and sodium polystyrene sulfonate. Additionally, antacids can interfere with the absorption of many other drugs, so it's crucial to check with your pharmacist before taking antacids with any other medication. Remember to always consult with your healthcare professional before making any changes to your medication routine. If someone takes too much Antacid M and experiences severe symptoms such as fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember to keep all your medical and lab appointments. Additionally, lifestyle changes such as stress reduction, quitting smoking, limiting alcohol, and making dietary changes may help to enhance the effectiveness of Antacid M. This can include avoiding caffeine, fatty foods, and certain spices. It's best to consult with your doctor or pharmacist about any lifestyle changes that could benefit you. And when taking Antacid M, make sure to follow the recommended daily dosage and take it at the optimal timing for the best results. If you forget to take Antacid M at your regular time, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose as scheduled. Do not take a double dose to make up for the missed one. It is important to take Antacid M exactly as directed by your doctor or as directed on the label. Be sure to follow the dosage instructions carefully for the best results. Typically, Antacid M is taken after meals and at bedtime, or as directed by your doctor. Taking it at the same time each day will help you remember to take it. It's important to store Antacid M at room temperature, away from light and moisture. The liquid product can be stored in the refrigerator to improve the taste, but be sure not to freeze it. It's also important to keep all medications away from children and pets. When it comes to discarding Antacid M, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard the product and it is expired or no longer needed, and consult your pharmacist or local waste disposal company for the best way to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.